So fatigue is common in the background population. So you'll have family and friends that suffer with fatigue, even, you know, people that aren't affected by mitochondrial disease. And there's lots of population studies that have been done in this regard. It's tricky to know what the real number is because, as I said, measuring fatigue is hard and it's changed across the course of time. So there's a big range in how people have the numbers there, 5 to 45% of patients, you know, just in the population experiencing fatigue, and it depends on how they've measured it as to what the pickup rate is there. And, you know, a number of people have this definition of chronic fatigue. There are studies in other neurological diseases showing that fatigue is very common in other neurological diseases, and you see that there's a table over here just with summarizing that, and you'll know from, you know, it's probably quite well publicized that fatigue is very common in things like multiple sclerosis and also in Parkinson's disease. And when they pull out all the different factors that contribute to fatigue, and I'll go through a few of those, they find that the disease process itself is still a significant contributor, aside from, you know, how do you sleep, what are your tablets, you know, other types of things that can give you fatigue. So they believe that the neurological disease itself is giving patients fatigue. So this is a slide just showing again about how common it is. Just showing one of these studies that looked at that. And this is your mitochondrial myopathy patients here. These are your control patients, and then you've got your chronic fatigue patients over on the other side. This is using the fatigue impact score, and I mentioned before that that's the score that's been used in mitochondrial disease in the past. A score over 40 is fatigue is present. Over 80 is fatigue is severe. And you can see that compared to controls who are mainly 40 and below, patients with mitochondrial disease are similar to patients with chronic fatigue, which, you know, chronic fatigue may include some patients with mitochondrial disease. But they're very similar in that regard, in that they both report significant fatigue. And in this particular study, they also looked at the severity of disease, and they found that fatigue was correlated to the disease burden, although that doesn't necessarily translate in all assessments of mitochondrial patients and fatigue. It was the case in this study. They also found depression and anxiety scores were quite high in these patients. It's hard with the depression and anxiety scores, actually, and one of the things that's tricky, and we've found the same thing in our study, and I'll go through that in a minute, is that, you know, you do often find this correlation between depression and anxiety scores and fatigue scores, and it's about, you know, what comes first. The scores themselves, when you look at the scales, they have a number of questions that are in common. So in the depression scales, they do ask questions about biological symptoms, and some of those questions are relating to fatigue. And so, you know, I suppose the question is, are you asking the same thing? And in some regard, some of that might be there. Also, you know, is it that fatigue makes you feel a bit depressed? It's, you know, it's highly likely that's an element. Or does depression make you feel a bit fatigued? Again, an interesting thing for us is, you know, do depression and fatigue coexist because of the disease process, and therefore can we modify that in a different way? But it's very important to be paying attention to the fact that depression is there, and whichever way it is that it's important. This study also looked at daytime sleepiness but didn't explore sleep.